peak flow is actually quite a common one. And just a few tips about this. So there's no need for you to learn the values. Make sure you've got enough disposable heads. Ideally, peak flow should be done standing. Make sure the meter set to 0. It needs to be held horizontally, flat to the floor. And then what they want to do, I'm just going to explain it first and then I'll actually demonstrate it to you. So you want to tell them they want to take a deep breath in. Okay. Ideally, they want to breathe out fully. And then when they're actually going to do it, deep breath in, tight seal around the disposable mouthpiece, blow out as hard and as fast as they can in a single breath. And then you want to take 3 readings and we record the highest reading. Okay. Last thing, just warn patients that sometimes when they do this, they might feel a little bit lightheaded. If that happens, or if they feel dizzy, for example, not to bother doing anymore. Because what can happen if someone is feeling lightheaded after the first one, if they try and do another one straight away, they might actually fall over. Syncope is a known problem in some patients with peak flow. So I'm just going to demonstrate how to actually do peak flow. On the day of the exam, you want to do it in a really, really fluid, slick way. You want to explain it first, then show the patient, and then just check that the patient can do it themselves. Okay, so let me just show you. Right, so let me show you how you might demonstrate and check that the patient can do a peak flow in the exam. So first thing is that patients learn a lot more from what they hear and see. So if you just describe it and then get them to do it without showing them, then if you miss something out, they may well get that wrong because they may never have done it before. So ideally you want to show them. So first thing, why do we do peak flow standing? Because if you want to look at percentage of expected, then the reference data is based on standing data. So that's why it's better to do it standing. It'd be more accurate. Okay. So first thing, you want to show them the peak flow meter. You show them that this needle goes up and down, and that before they do it each time, they need to set it to 0. Okay. Then to put the mouthpiece on like this. Okay. So the disposable mouthpiece. You need to explain that the hands need to be held like this, and it needs to be flat to the floor. Okay, because if it's upwards, you're going to get an inaccurate reading. Equally, if it's downwards, it's not going to be perfect. It should be flat to the floor, horizontal. And the needle needs to be able to move freely. That's why the hands can't be like this. You can see if the hands were covered like this, then they wouldn't be able to get an accurate reading. So you've put it on, breathe in, breathe all the way out. Then you explain that they're going to take another deep breath in, tight seal around the mouthpiece, blow out as hard and as fast in a single breath like this. One single breath, okay? And then after they've done it each time, they reset it back to 0. Deep breath in again. Okay, and what they're recording is whatever the number is. So in this case, it's 500. That's the number they're going to record, okay? Do it 3 times. Take the highest reading, not the average, okay? And if they struggle, just to leave it, okay? If they feel dizzy or feel a bit lightheaded, to leave it, as we talked about. One thing really important, don't forget once you've demonstrated to take this off, okay? Put it in the bin, put a fresh one on before you give it to the patient, okay? So that's peak flow.